Kids by now.
All right, we are recording. Hello. Greetings. I'm going to share my screen. Thank you all for joining us today. December afternoon. Today we are here to discuss the creation of a food prescription program, which we do not have in Northwest Tennessee. And we kind of put these beliefs, if you believe that food is medicine, you believe that all deserve the right to healthy, accessible, and affordable food, then you're in the right virtual room. So welcome. So today's agenda, I thought we could quickly introduce ourselves. And since I'm talking, I'm going to go ahead and start. And the way we do this is we pass the hot potato. So after I'm done presenting or introducing myself, then I'll pass the hot potato on to somebody else. So my name is Samantha Goyrette. I am part of the Northwest Tennessee Local Food Network. And we're the ones that have organized this meeting. So I'm going to pass the hot potato to Caroline.
Yes, my name's Caroline Ideas. I'm also with the Northwest Tennessee Local Food Network, and just kind of I'm excited about this, and we'll get more into kind of where we are and how we got here in a little bit. Rich? Oh, we cannot hear you.
I cannot hear you. I think you're on mute, Rich. Or not on mute, but something going on with. Heard you earlier. Nope.
There was some weird feedback. Sounded like mosquitoes.
Looks like the computer might want to do something. Well, in the meantime, Brian, why don't you introduce yourself?
Yeah, I also work with y'all at the local food network, teach nutrition classes at UT Martin. I'm also on the board of directors with the Tennessee Academy of Nutrition Dietetics, which is our state dietitian organization. So, and just got asked to be on the Extension Advisory Council too. So the stuff like this is like right up my wheelhouse. When I saw you guys were having that, I thought, like, I'm on break. This will work perfect. I have nothing to interfere with it. So looking forward to it. Thank you.
Excellent.
And sorry, Rich. If you can just use the chat box, and as long as you can hear us.
Well, we could hear you before, so maybe logging off and joining us back again, that might work. I don't know. Tricks of the computer, because we don't hear you at all. Oh, that was Caroline. And it is the nature of technology where sometimes it works and sometimes it doesn't.
Even though it worked like 5 minutes ago.
I know. You never know.
Ain't that the truth? Yeah, my video on my laptop went out somehow. I had to finally call IT, and they actually had to come to my office to fix it.
Oh goodness!
It worked 5 minutes ago.
Yeah, that's just Murphy's Law. That's like my dad. He knows how to work cars really well, and my car would act up, but as soon as my dad would look at it, it'd work just fine. All right, welcome back, Rich. You're connecting to the audio, it says. So let's see if it worked. Okay. Testing. Oh, no, there is some kind of, it's like the computer wants to do it. It sounded like a mosquito. I guess we're just going to have to use the chat.
Yeah.
Well, Rich Reynolds is part of the Hometown Health Clinic. I'll just go ahead and introduce you, Rich. And we'll have the chat open. You're welcome.
So Rich can hear all of us. Is that correct?
You can hear us? Yes, nod with the head.
Okay.
We can see you. I know a little bit of sign language, but not very much. Okay. Well, this is just going to be kind of a short and a sweet introductory meeting. We wanted to meet before the new year just to get our feet wet a little bit and the whole food as medicine movement or food prescription movement. We'll go over an intro about who we are as a local food network, what it is, food as medicine, what is that movement, the purpose of the food prescription program, And then just brainstorm about who else we can invite to the table to join the conversation, and set dates for 2024 cadence meetings where we'll strategically discuss different aspects about how we can create a food prescription for our region in Northwest Tennessee. So the Northwest Tennessee Local Food Network, we are a nonprofit organization, 501c3, and our mission is to serve as a catalyst for a thriving and equitable local food system that is accessible to all in our region. Now, our region encompasses 9 counties from Benton all the way to Lake, down to Carroll, and in between Dyer, Gibson, Henry, Obion, Weakley, Crockett. I think I got them all. But 9 counties within our Northwest Tennessee region. And our vision is really, we envision a sustainable regional food system that's resilient to external influences, and that we can, maintain our own and keep strong, but really utilizing the locally grown foods that are produced here to help promote healthy individuals, which then promote healthy communities, which then leads to healthy local economies. So we are a small but mighty team. Caroline and I, we're the only full-time staff members. And then we have a part-time financial director, Win-Win, and an amazing set of interns that rotate on an annual basis. Okay, you're up, Caroline. I'm just gonna.
Okay, yeah. So as Sam touched on a little bit, our food network believes that in our food system, everyone has access to nutritious, healthy, and affordable foods. And as we are aware, that is currently not happening, but that is what our organization strives to do. And so, as mentioned, it creates a sustainable future for everyone. And as both you and Brian and Rich know, healthier food, healthier lifestyle helps reduce health problems later on in life, or even early on in life, depending on just the situation. And so, right now, what's going on in our area, we have a lot of cool things, a lot of great growers. And so we want to bring all these partners all the growers and partners to the table to help create a healthier community. And so food system change when we all come together. And so we're working on that right now. And so the concept is food is medicine. This meetup was in May 2022. So I guess nearly a year and a half ago. And so it's sort of stuck with us. And then we've talked Sam and I, just on outside of the network. I mean, officially, but not as a meetup like this, a public meetup, to other food prescription programs, and how it does make a difference. And even though it's just maybe like 8 to 10 families, this one particular program we spoke to, I believe somewhere in Appalachia, North Carolina, like their pilot was 10 families. And it may not seem like that much. I mean, in the scheme of things, it isn't, but it made a big impact for those families involved in the food prescription program. And not only did they have a weekly CSA, but they had an educational component to teach the consumers,
Patients, yeah,
the patients, how to use those foods. And that's the biggest element, because you can give someone a box of vegetables, but they if they don't know what to do with it, it just goes to waste. So here's a little clip of our meetup from Dr. Olson, and this is out of Utah, and Utah has a lot of there's a lot of organizations about plant-based eating and food as medicine and food prescription programs.
So we had invited folks from all over the country, but Brian was a big part of this conversation as well. What Dr. Olson, you're good, Dr. Shoot, I was good, and then I'm not good. Good afternoon. My name, sorry, we're not going to listen to the whole thing. We're just going to listen to a bit. I promise. And I had it there, and then I pressed the wrong part of the screen, but that's okay. Going to 56 minutes and 30 seconds. And it's just a minute clip, but it kind of nails the whole food as medicine and why this is so important.
Investment to change the system with everything else that's out there. So I think that part of what we need to do is to figure out how through society we understand that healthiness is not the absence of obvious clinical disease, but it's a state in itself which frankly prevents the most important clinical diseases. That's the paradigm shift that I think is critical to make. And yet, if you talk to patients about this, they have been so grown in the idea that there's a pill for everything or a simple fix, that the idea that, you know, you just can't get a prescription and have this problem or that, and that it would require some effort that actually may be more expensive, some exercise, some diet change. That's hard enough that most physicians without support will say it, but just saying it without other support, it doesn't go anywhere. So that's where I think something like what you're doing here and others have tried to do to get the word out and to point out that so much of what we have in chronic disease is preventable, and that quality of life, if people could start taking some responsibility, not expect the hospital medical complex to give a magic formula to make them better.
So there you go. That kind of sums up the whole food as medicine. What he said was just really kind of spot on. And it really kind of set the stage in motion to where we are right now. Last year, Caroline had applied for a food prescription like preparation grant to help us plan to implement a food prescription program in our region. And surprise, surprise, we got it. So that is what's helping us kind of fuel the fire to keep this moving and figure it out together and how something like this we could do. But really just to dive in a little bit deeper to the food as medicine movement is that it really relies a lot on research and support. These kinds of programs. So research is an integral aspect of a food prescription program, but it also provides an opportunity for our farmers to really connect with those who have those health disparities, to those who have like, you know, not only health issues, but even socioeconomic issues where it's hard for folks to access really fresh, good local food because of the money issue. So I'm not going to read this for what it says. I know y'all could read it, but that was actually a quote from this year's Climate Underground conference. And those two that actually provided those quotes are doctors that are into the food as medicine movement. But really, it's that last sentence that kind of nails the nail on the hammer, or the hammer on the nail. A critically important aspect of this work is ensuring that these approaches reach underserved communities through community-wide health initiatives. So the fact that we have y'all's interest and there's this collective energy that is starting to form around this is really beautiful. And I'm very excited to see what could happen out of this. Now, part of this grant that we received, the whole idea was to apply for a GusNet produce prescription program. Now, last year, the RFA was due in May. So we had designed the whole like planning of this program to then submit an application in May. Well, they changed the date. Now the application is due this February. We are not going to have a proposal ready in February, and we do not want to rush this in any way, means or form. So we have gratefully received an extension of this planning portion of a food prescription program. And I'm actually grateful for that because that allows us more time and wiggle room to really figure out a good way to move this forward, and so that it's equitable with all the partners that are included and fair. And and just beneficial, especially for the patients that will eventually, hopefully, benefit from this program. So the purpose of the GusNet Produce Prescription Program, which is through NIFA, National Institute for Food and Agriculture, is to bring together stakeholders from various parts of the food and healthcare systems. With Hometown Health Clinic, I think Hometown Health Clinic is a fundamental partner and really exciting because you're so ingrained within the region. Like within our region in Tennessee, there's no other regions in Tennessee that have the setup that Hometown Health Clinic has. And so I think it could be very impacting and cause a ripple effect within our region to implement a program like this. Okay. Now, the next part of the GusNet project is really to help foster this understanding, to help improve the health and nutrition status of participating households through prescribed fresh fruits and vegetables. And of course, having a program like this, it's always encouraged to create partnerships to enhance the program delivery, which, we can't do anything by ourselves, but together we can form an amazing impact by working together and using all of our different assets that we have in a collective way for the benefit of the greater good. Part of these grant funded projects, we have one of the things that we'll be working on over this next year is to figure out how are we going to demonstrate that we're actually having an impact on the people who are part of this program, and how do we evaluate that impact? So, the main thing is that we do need to provide some kind of food prescription. That's actually the second bullet point, but the improvement of dietary health through increased consumption of fruits and vegetables. We have to figure out a way to prove that. What kind of metrics do we want to use? What kind of data sets? What are the ins and outs of the HIPAA compliance? And do we need to do an IRB? So lots of things to look into. And then also part of it is really, how does this program reduce the individual and household food insecurity? Hometown Health Clinic is amazing in McKenzie. They have a food pantry and they do offer food for those for their patients who need it. So I think all this food, it really just ties hand in hand. If you don't have access to food, it really affects your health, period. Mm-hmm. And then also, will this program reduce the use of healthcare use and associated costs? Now that's kind of a long-term, I think that's a long-term evaluative metric. Although with some of the food prescription programs that Caroline and I have looked into, we have seen within 16 weeks, the number of the percentage of diabetes, the insulin levels of diabetic patients who are in this program actually go down. So it's almost an instantaneous result, which is pretty amazing.
Yeah, I mean, which is pretty wild just in 16 weeks.
How, a change of diet can really affect your health outcomes. Okay, so these are the musts. This is within the RFA. Now, granted, in 2025, the RFA might change, but overall, there's two things that we must provide. One is to include a letter of support from one or more healthcare partners. The other is that there has to be some kind of premise that there is a prescription of fresh fruits and vegetables to eligible individuals. And that
question, Samantha.
Yes.
Mm-hmm.
What for the first one, they're healthcare partners, so that you're looking for a group maybe to partnership with?
Well, a group like Hometown Health Clinic, because they are a group of health clinics. Am I assuming that right, Rich? Yeah. But it could also
so then, like the Western Tennessee Academy of Nutrition Dietetics, that's our local Western district of TAN.
Mm-hmm. Are they a nonprofit?
Yes, we're nonprofit.
I mean, it could totally be a partner. But the only one requirement is that we've got we can have lots of letters of support, but the one that's most important is from a healthcare partner. So it shows different that we are actually partnering with a healthcare partner.
Yeah.
That works.
Yeah,
perfect.
Who sees patients and that kind of thing. And then one of the following, there's three options here. We could do 1, 2, or all three. One is to provide financial or non-financial incentives for eligible individuals to purchase or procure fresh and fruits and vegetables. So that could look like, I mean, it's amazing all the different programs that are around the states. Like, we do not have to recreate the wheel, which is great. We could glean ideas from all these different amazing organizations that are doing this. Some, use farmers markets to procure fresh fruits and vegetables. Some use the supermarket. Some use mobile food pantries to do that. Some use coins. Some use actual prescriptions. Some just give the people, money or a gift card, so they actually use it. But
and some actually just have an actual CSA type box that the recipient picks up. So, yeah.
So there's all different models that we can look at and we can glean from, which is nice. One of the other things that can be done is providing educational resources on nutrition. So, like, cookie classes, which is kind of the primary example, or even just, handing out recipe cards like, hey, this is a kohlrabi. Do you know what a kohlrabi is? This is how you cook it. And then also the other one, and last, it kind of ties into the first, like the second bullet on the very top, but to establish additional accessible locations. So, if we're thinking about Hometown Health Clinic, they have clinics all over our region. So how can we get these fresh fruit and veggie prescriptions to the patients that are within and around that particular health clinic, whether it's in McKenzie or if it's in Dresden or if it's in Dyer, wherever that may be? What's the best way to go about that? And so that's another thing we'll be digging into. They're all rhetorical questions right now. We don't have to have answers right now. But it's just more food for thought about the basic premises of the things that we're going to have to dig into. Any questions so far? One of the main things is that the people who use and buy fresh fruits and vegetables, those fresh fruits and vegetables cannot be taxed. That's the catch. So I don't know how to go around that. Oh no, sorry. I just went crazy quick. Okay. So one of the questions that I'd like to propose to y'all as a group, food for thought. There is no answer to this right now, but while food insecurity is a big problem in our region, it's a big problem across the United States of America. But as of late, we as a local food network have been getting at least 2 to 3 calls a week of people just looking for food. They don't have access to enough food, just period. Doesn't matter what kind, anything that you can eat, they don't have enough. So how could we use these food prescriptions that could support people experiencing food insecurity and improve their health outcomes? Who is that population? How can we reach them? So this is just food for thought to think about. Because we will have to come up with a target population, but who is that? And can it be multiple target populations? Can it be both, elderly patients and maybe pregnant mamas? I don't know. It's something to think about. Okay,
and that will be the biggest kind of the next conversation is the who and how, like who are. I mean, we kind of know we're in rural Northwest Tennessee. Okay, so we have a rural population mostly, but which part of this population we want to focus on and how are we going to get to them?
All of these questions have answers, and in time we will find those answers. For now, we do not have to have those answers, but we would like to be able to invite more folks to the table to join this conversation. And I think right now, and hi, Paige, sorry I didn't say hi. And I saw you jumped on the call. Paige Summers with the Tennessee Department of Health. And I think those who are on the call, even right now, and who have already expressed initial interest, especially the Millers at Blackberry Pond Farm, who offer a CSA. I think we've got a pretty strong core group of folks. Amy Richards, who also was not able to attend today. She works at the University of Tennessee at Martin, and is a researcher. And this is kind of her job. This is like her cup of tea. right here, this kind of initiative.
Mhm.
So she is also very interested in the research part. So having, you know, UT Martin, Hometail Health Clinic, the Tennessee Department of Health, we have a farmer, farm as an initial start, I think is wonderful. But let's just, you know, keep on thinking, who else? Do y'all have any other
Rich,
ideas?
I don't know. I don't know
Yeah,
if you saw his comment, but Rich mentioned UT Extension, which is a really good idea, Rich. I agree.
Yes, extension, absolutely. And with the educational piece, that I think that would be fundamental.
yeah.
Like Lacey.
Mhm.
Yeah,
Um,
in Carroll County.
Now, you know, we also don't want to exclude anybody, and we want to be inclusive as possible. So, could we get maybe an interested patient that might be interested on the patient side of things? You know, and that's a little bit trickier, harder to find. But can we have somebody who has experienced, you know, maybe some health disparity and has changed their lifestyle? That would be interested in this kind of subject. I'm thinking Jackie Jones probably would be really interested in this, Carolyn. Because she was the lady on the call with Dr. Olson, who was agreeing with him. But anyway, this is really food for thought. If you think of anybody
Well,
that might
Rich said he'll think about it and he should be able to find someone or someone's.
Yeah. Okay, excellent. And after this meeting, we'll send a follow-up email with this invite, the Survey Monkey invite, and that's just kind of our initial interest intake form. So if you think of folks, just go ahead and send them that invite. Like, hey, I want to invite you to this. Come and join us. Okay, so cadence meetings. We're calling them cadence meetings because, like marching bands, we want to beat to the same drum, right? So we're starting the rhythm. We're starting the rhythm of this food prescription program. And I really liked this chart because one, there is a part of me that does feel a little overwhelmed starting a program like this. And this graph kind of shows that overwhelming.
Yes.
But what I like about this graph, look at the color blobs, okay? Scale, delivery, and use, user experience, roles, and responsibilities. Those are the three premises that we're going to hash out over our 2024 cadence meetings. So we're going to create our own graphic. But I like a lot of the things that was said in here and written in here as to the different things that we really have to think about. So we would like to meet bi-monthly starting in January. So twice in January, twice in February, maybe once in March, just because spring break is in the mix there. And Caroline and I do plan on visiting one of the food prescription programs over in East Tennessee. And then once or twice in April. We'll take a break over the summer because that's the growing season. And both Caroline and I are farmers market managers. So it's just that they but the NIFA grant isn't due until February. So we'll reconvene back in the fall of 2024 to finalize any details and really get a solid grant application that's equitable for all the partners together. Anybody have any initial thoughts about this slide? Or any questions? Put in the chat. I lost my chat box. I can't see it.
Oh, let's see here. Rich said it's busy. Yeah, yeah, it is. It's a lot, and that's how. If you get bored over the holidays, and you could read the RFA, and your brain will look like that after reading this RFA.
But more than anything, I didn't want to overwhelm you with this graphic. I just want to be completely transparent that like what we're going to start, it may not be easy at first, but by doing it slow, I think we're going to have a really good chance in starting a program that will not only last throughout whatever the term of this RFA is, but will last for years to come and will benefit so many people in the meantime. And, hopefully we'll see a decrease in health disparities in our region because of it. Wouldn't that be amazing? So yeah, call me a half glass full kind of gal, but that's kind of what I'm thinking. I think there's a really good opportunity here. And the fact that we're all together in the same room and there's so much interest around it, I think we could do it. I think we can. So, okay, I'm gonna scoot out of that slide. Just come back. Whew. So Caroline and I, we're here. Accessible. If you have any thoughts or ideas, send us an email, shoot us a text, send us a Facebook message, whichever way you want to communicate. Give us a call. But we are excited to start something. And before we end the call, we'd like to get some roundabout idea of when would be the best time to start meeting in January. Is there a common, Brian, I don't know if you have your class schedule yet for the spring semester. But
Yeah, mornings work best for me, or anytime Thursdays. Yeah, any Thursday, anytime works, and then Monday, Tuesday, Wednesday before 1 o'clock. Yeah, I've got a pretty good schedule finally.
yeah,
Well, congratulations.
Yeah, don't tell anybody.
Yeah, I know. Before it changes. Rich, could you type in the chat what's a good time? More or
He
less.
said Thursday mornings.
Thursday mornings. Okay, that sounds like a good theme. Paige.
I am looking at, I'm sorry, I'm off camera. I have a cold
It's
and I've
okay.
just been over here blowing my nose.
I hope you
Thursdays in January are kind of wonky. If you guys just pick a day and just send me an invite. I mean, usually the mornings are okay. My schedule's kind of all over the place in January, but I will hopefully be able to make it work. But the mornings are usually better for me as well.
Okay. Well, classes start that second week of January. So, and I'm thinking of UT Martin. So what about the January 18th? That's a Thursday, 9 o'clock Central.
I have something from 9 to 10, but I could do after that, or if y'all wanted to do early 8 to 9.
We can do
I can
10.
do 8. I mean, whatever works for 8 or 10, whatever you guys.
10. Yeah, I want to do 10.
Let's do 10:30. Can we do 10:30? It'll give you a little
Rich
bit
says earlier the better. 8. I mean, if 8 is better for everybody, but I can do that too. That's fine.
How does that work for you, Caroline?
Yeah, I can make it work.
Okay. Well, then we'll set it 8 to 9 on the 18th of January. And then that meeting we'll figure out kind of a good schedule. We'll know a little bit better our schedules then, I think, to figure out, set a couple of meetings. That way we've got it on our calendars, and we can roll out with the game.
I did want to let y'all know about a meeting I had last week with a doctor at Vanderbilt Pediatrics.
Okay, please.
I'm assuming it's GusNIP. He didn't say. Or actually, no, it's not GusNIP. It's another grant. And it's also a produce prescription grant, and they are applying for it. And I know, obviously, Vanderbilt's in Nashville, but I believe it would be statewide. So they were looking for some feedback when we had our nutrition security collaborative call. I guess it was last week or the week before. They were looking for some feedback from partners about that. So you might want to reach out to him and just let him know, hey, we're doing this work in, Northwest Tennessee, blah, blah, blah. Just because it sounds like that's also a big kind of project. I can connect you guys over email.
Oh, that would be wonderful.
Yeah, some get more information, but just want to let you know about that.
Well, and we've been really intensively working in the schools. So we do have great contacts in our region. And, kids are a little bit trickier when you're working with them. There's a lot more, they're just a lot more protected. We want to protect our children. So I don't know what that piece looks like. But kids also have health disparities, and if you can nip it in the bud earlier, the better it is for them in the long run. But again, we will figure out the population and how we want to do this starting in January. We're going to, you know, just take it bit by bit and figure it out together. But in the meantime, looking at the RFA is a good start to kind of get you into the groove about what this program could mean and what it could look like and what are the different elements we need to discuss. So yeah, that's kind of it for today. we wanted to share this idea and get excited about it. And,
yes, Rich, we will send out the RFA, and I saw your comment earlier about the video with our conversation about food as medicine, and we will also send that out yes, Sam, sorry.
The survey.
Yes, the survey. Most of you did the survey already.
Yeah, so you're good to go.
Yeah.
Thank you very much for.
Yeah, all of them have done it. They're on this call.
All right, well, we'll plan to meet then again on January 18th at 8 a.m. I will send out a Zoom link with our follow-up email. That way you can just go ahead and get it on your calendars. And in the meantime, I hope you all have a very wonderful, happy holidays, Merry Christmas, Happy Kwanzaa, Happy Hanukkah.
Happy New Year.
Hello. I'm sorry, my late tardiness. I just got back from vacation 45 minutes ago.
Oh, that's okay.
I'm gonna have to look at my calendar for January the 18th at 8 a.m.
Sure, that's fine. Thank you, Alicia. And Alicia Duke is our research intern, so she's helping us with the research end of this program. All right, everyone. Well, thank you very much for joining us today. I hope you all stay well, stay healthy, eat lots of yummy food over the holidays, and enjoy a little bit of downtime.
Thank you.
Thanks, guys. See ya.
Talk to y'all next year.
Bye-bye.
Bye.
Bye.